Welcome back to our Pediatric Dentist channel, Tiny Teeth Talk. If you are new to this channel, subscribe the channel. And for details of this channel, visit the bio section. See, we are going to cover this topic deeply in detail, so it can't be finished in one or two parts. So you have to stay with us with some patience. Today we will start nitrous oxide sedation in pediatric dentistry. So first, you have to know how nitrous oxide stored and work and how to use it. So nitrous oxide is stored in highly pressurized gas cylinders constructed from lightweight chrome molybdenum steel, aluminum or composites such as the aluminum wrapped in a carbon fiber. A typical cylinder is formed of a body and the valve which is attached to it. This is the body and this is the valve. Body forms the bulk part of the cylinder. It continues into the neck, which is the narrow part and which has a tapered screw at the end and connects to the valve. When the valve is screwed to the cylinder neck, the fusible material, which is Wood's metal, is used to seal leaks between the valve and cylinder. This material will melt if the cylinder is exposed to intense heat, thereby allowing the gases to release and reduce the risk of explosion. Nitrous oxide cylinder's body is colored blue internationally and light blue in the USA. Body of oxygen cylinder is colored white internationally and green in USA and colored black in India. Then coming to the valve. So this valve provides a means of connection to the yoke assembly on anesthesia machine. This is the yoke assembly and this part where the valve of the cylinder is connected. The valve, which is made out of bronze or brass, allows the gas to exit through the cylinder by opening this valve stem. Perhaps the most important characteristics of valve is the pin index system. It is a one of its kind configuration of holes and pins which is like a key and lock. This is designed to eliminate connection of the wrong cylinder to the equipment, thereby preventing delivery of wrong gas to the patient. This is also ensured that a cylinder can be only connected to a yoke with matching pair of pins. Pin index valves are fitted in small cylinders which are commonly connected directly to the anesthesia machines. Coming to the storage. Oxygen is stored as a compressed gas in cylinder, but nitrous oxide is liquefied under pressure. Nitrous oxide cylinders are filled about 90 to 95% of the capacity with liquid nitrous oxide. As the gaseous nitrous oxide escapes, more of a liquid nitrous oxide vaporizes to replace it. Partially filling the cylinders allows some leeway in an event of exposure to sudden high temperatures, which could result in bursting of cylinders as a result of increased pressure. Hence, these cylinders are only partially filled with liquid depending on the climate in which they are used. As the gaseous nitrous oxide escapes, more of the liquid nitrous oxide vaporizes to replace it, and the pressure of this new gas is 750 psi. This process continues till no more liquid remain to convert to the gas. Therefore, the pressure gauge in the nitrous oxide cylinder cannot be used to accurately predict the amount of the gas remaining in the cylinder. We have to follow the handling instructions for cylinder. Before any movement, we have to check that valve should be properly closed and valve protection cap should be properly secured. So the valve should be properly closed and cap should be secured. During movement, cylinder should not be dropped or to be allowed to strike against each other violently. Cylinders should be strapped or clamped during transport in a vehicle. Do not lift cylinder by the cap. Avoid dragging or sliding cylinders. Cylinders should always be carried on a trolley which have a mechanism to prevent its slippage from trolley. Now during storage, cylinders should be stored in well ventilated and locked areas. It should not be stored in areas where temperatures are in extreme. Cylinders should be checked for label and color. Cylinders should be stored on a leveled floor which is clean and dry. Large cylinders should be stored vertically and small cylinders should be stored horizontally. Cylinders are placed in such a way that they do not fall and cause damage to the surroundings. During fall of cylinders, valve may get damaged and may cause leakage from the cylinder. A single cylinder may cause falling of other cylinders, hence each Each cylinder should be secured in place. Cylinders should not be stored along with the inflammable material. Cylinders should not be stored in areas where movement of people take place. Cylinders should be labeled as empty, filled, or in use. Now, during opening and closing valves, handling should be done by trained staff only. Seal over the valve should not be tampered with and should be opened just before connecting the cylinders to the yoke or the manifold. Most appropriate way of opening the cylinder valve is to open the valve momentarily and then close it. After this, the valve should be opened slowly. This process is known as cracking the valve. This allows the equipment to get adjusted to full pressure. Valve should not be over opened because it might cause leakage of the gas, and valve should not be over closed. At the end of the day, it can build pressure and there is a chance of burst. Now, inspection of cylinders before use. Inspect the cylinders for any damage. The valve seal should be intact. The valve should be free of dust or oil. Oil and grease can react with the oxygen to cause explosion. Dust can cause a spark when in contact with high velocity gas. And check the valves for leakage. Let's see which part of the body affected by nitrous oxide gas. Systemic effects of nitrous oxide. Central nervous system. Nitrous oxide depresses all form of sensation using sight, hearing, smell and touch. As long as administered with more than 20% of oxygen, the effect on the central nervous system are limited to a mild depression of cerebral cortex. Vomiting center in medulla is not affected by nitrous oxide as long as physiological concentration of oxygen are maintained. Then respiratory system. Nitrous oxide gas has no significant effects on cardiovascular and skeletal systems and has minimal effect on respiratory system by decreasing the respiratory drive. It slightly decreases the tidal volume and increase respiratory rate. Nitrous oxide should be avoided in the patient suffering from COPD. Why? COPD can create weak air-filled pocket in the lungs called bullae, and because nitrous oxide expands trapped air, it can make these pockets pop like a balloon, causing a collapsed lung. Now, patients with severe COPD often breathe based on the hypoxic drive, means low oxygen levels tell them to breathe. Since nitrous oxide is always given with high oxygen, it can trick the brain into thinking it doesn't need to breathe, leading to respiratory failure. Let's see recovery from nitrous oxide anesthesia. So, nitrous oxide diffuses out of blood into alveoli and is eliminated through the lungs. The recovery from nitrous oxide is usually rapid and complete, and the patient may be permitted to leave the office unaccompanied. There are no residual effect after nitrous oxide anesthesia, and this is one of the main reasons of its widespread popularity. However, escape of large volume of nitrous oxide may cause one phenomena which is called diffusion hypoxia or diffusion anoxia. Let's see diffusion hypoxia. So, diffusion hypoxia happens right after the dentist turn off the nitrous oxide. When you stop the gas, all the nitrous oxide that was in the patient's bloods want to leave at once. It rushes back into the lungs to be exhaled. Because so much nitrous is flooding the lungs, it crowds out and dilutes the other important gas. So when it dilutes oxygen, there is no room left for oxygen in the lungs for a few minutes, and it causes transient hypoxia. Dilute carbon dioxide. So since CO2 is also escaping too fast, the level of CO2 in the blood drops. Your brain uses CO2 as the trigger to tell you breathe. When CO2 is low, the brain thinks I don't need to breathe right now, and the breathing drive slows down. This lack of oxygen and slow breathing is what cause the nitrous hangover, and it causes headache, nausea and feeling very tired. To prevent this, the dentist give the child 100% pure oxygen for 3 to 5 minutes at the end. This washes out the crowding nitrous and ensure the lungs and bloods are flooded with oxygen, so the hangover never happens. Let's see the mechanism of action of nitrous oxide, how it works as a sedative agent. So the first person to recognize anti-analgesic properties was Humphrey Davy as early as 1800. Nitrous oxide is unique because it hits three different targets in the brain to produce its effect. First is analgesic effect, pain relief. Nitrous oxide acts like a natural painkiller by triggering the release of the body's own pharmacy. So it stimulates the release of endogenous opioids, which are endomorphins and dynorphins in the brain. Now this natural chemical binds to the opioid receptors in the spinal cord, scrambling pain signals, so the child feels slightly less discomfort from the things like a needle prick. And then anti-anxiety effect, anxiolytic. This is the relaxing part of the gas that calms a nervous child. It interacts with the GABA A receptor in the brain. It increases the inhibitory signal in the brain, quieting the parts of the mind that process fear and panic. This makes the child feel indifferent to the dental environment. And the third is anesthetic effect, loss of consciousness or memory. In dental setting, we only use light sedation, but the mechanism is still there. So it blocks NMDA receptors, which are glutamate receptors. So glutamate is the brain's main excitement chemical that keep us alert. So by blocking these wake up signals, nitrous oxide produce a dreamy, slightly sedated state. It also causes mild amnesia, meaning the child might not clearly remember the scary parts of the procedure afterwards. In next part, we will cover stages of anesthesia, stages of nitrous oxide sedation, its clinical sign and symptoms when use it, etc, etc. Till then, if you want this PDF or any other PDF, just like, say, subscribe the channel and comment the name of the PDF you want. New videos on Sunday, and don't forget to check our weekly shorts. Thank you.